Hello, everyone. Today, I have Dr. Jeremy Shapiro, who is a board-certified pediatrician. How are you doing, Dr. Shapiro?
Very good today, Elon. Nice to see you, and thanks for having me.
Yeah, are you ready to get started?
I am.
All right. Now, what inspired you to go into medicine, and what about pediatrics specifically?
I think for me, I always enjoyed the science, health, public health sort of aspect of school and kind of my upbringing in classes in college. But I also spent my summers as a camp counselor, a camp director near the end. And I think I really turn around kind of this question you're asking and say, I think it's pediatrics that inspired me to go into medicine. I went to medical school pretty much knowing that this is what I wanted to do. So it made it pretty easy. Certainly other things to enjoy when I got to medical school that I could, fill you in on it if interested. But I think it was really the blend of pediatrics, the patient care, the parent involvement, and then just enjoying public health and science. And it just seemed like a perfect fit, perfect match.
Yeah. What did you enjoy about public health? In my mind, pediatrics and public health don't go super smoothly together.
Well, I think we could have that discussion. I'd be curious to hear your thoughts on why not, and if that's the case, maybe we can have a little discussion there. Public health, I've always been a believer. It goes beyond just the individual. Now, when I take care of children, when I'm a pediatrician, I'm in the patient room with one child or siblings and their parents or caregivers. And I do look at those children individually. Every child is an individual. But public health actually does help determine some of the approaches that we do. I mean, as simple as hand washing, but then also the mental health component, and then my some simple tentaments. Just being healthy, sleeping, getting good sleep, which I spend a lot of time on, and good eating, healthy, balanced eating, and then the physical activity too. So I actually think public health does play a significant role in addressing children, but never leaving the mindset of each child that you see when you're with that child, it's an individual and not just the public health component.
If you don't mind me asking, of the three big pillars of nutrition, sleep, and exercise, which one do you see most kids are, I guess the word is lacking, or even in the other end, which one are they excelling the most at?
Yeah, that's a great question. There's a range. I'm not going to say one's 100% and one's a 0%. If I just allow these three to pop up, I think sleep sometimes gets concerning as the children get older. And I think part of the reason is the things that we have, to the next of us, that we plug in next to us, depending on the age, hopefully not until we're in high school, but we're talking about the phones and social media and the other devices that we have access to. I think that has been very impactful in many ways, but when it comes to sleep, I think it's shortchanging the sleep, the total amount, and I think it's compromising to some degree the quality of sleep well. But I don't want to undervalue the importance of the issues of healthy eating. Not always an easy thing to tackle and address as children get older, and you might have been one of those. But as children get older, I think the palates expand and trying new things comes into play, and that becomes a little bit better of being more accepted or accepting of trying new things. And then the physical activity. The patients I care for, it's not about playing on a team sport necessarily, although I think there's great benefits from that, but it's about being physically active, whether it's a one-on-one thing, at home doing Pilates or yoga, the dog walking, bike riding, or playing team sports. Whatever it is, it's important to get that heart rate up as well. But sleep might tip the scales, I think, in response to your question.
Yeah, and I'm sure you've seen the impact of phones on kids' mental health, on their physical health. Is that a trend that you've seen more and more, or is this a recent thing?
Yeah, excellent question. Yes, it is more and more. We could talk about when it really ramped up. I mean, in my 20 years, I've been practicing around 20 years now. coming out in a little over 20 years, actually, when the smartphones weren't really in play yet. So it's been an easy trend to identify, an unfortunate one too. And I think, like some things, you have a pendulum and things swing too far in one direction. I think we'll see the migration back. I don't know how quickly. It's not just a one solution here. You may be aware schools are now tightening things up, locking the phones up, and that's a strong word, but putting them away and having some guidelines and rules. Not everything's been established, but I think even the major public school in our area is trying to figure out how to do this. But then it's also got to fall back into the home and outside the school too, and that's where it comes to the parents. But the impact of the smartphones, and they help save lives. There is some great good that come from smartphones. I don't want to take away from that. But at the same token, I think the impact on a developing child, adolescent, pre-adolescent, adolescent, and even adults at sometimes, I think it's very impactful and not always in a positive way.
Yeah. What are some of those positives for smartphones?
Okay. I think the communication, just being able to reach out with parents, the simple things. This may not necessarily save lives, but as far as communicating, being at the park, I remember 30, 40 years ago, waiting for a ride to pick up, and maybe the wires got crossed by the parents and no payphone. I'm sorry, I'm dating myself, but I'm sure it's not too hard here, but no payphone available, and just having to wait until someone was coming versus a cell phone just makes that easier. I do think the technology related to just Uber, some of the applications that go with that, and Lyft, and I don't have shares in either one of these companies, but I think can be rather life-saving too, and people not making the wrong decision in regard to driving and when not to be driving too. So I think there are just some, just a couple things there that that are impactful. But I think the communication with the parents when not at home is certainly a positive.
Yeah, Uber is not something I actually like that first came to mind, because it's like, take for granted, just you can call, like, summon a car at like a moment's notice. But then that car can save people's lives instead of you being behind the wheel under the influence or something.
Yeah. Now that's not smartphone technology, but it's the applications surrounding smartphones. So, there are there's some, I guess I won't go into all the apps, but there are apps that have been created that have been very helpful. And I think some address the mental health too, and meditation and things of that nature, where the pendulum has to swing back, not 180 degrees. Well, and let me rephrase that, not 360 degrees, because that'd take us right to where we are right now, but about 180 degrees, or about 175, is just the social media though, and its impact and role. It's concerning. The teenage, the pre-teenage, and if you're younger and you have, the ability to get a hold of some of the social media, I could not comprehend that as a child or even a young adolescent, all the influence that can come through social media. It's one thing to pick up a phone in the old days versus texting a friend now, get that, or a video call. But I think or FaceTime, sorry, I won't date myself again, but FaceTime or something like that. But when we're talking about all of the influencing that can occur via social media on a developing mind, it's very concerning. And that comes down to parents, kind of jumping in there and appropriately jumping in and taking some action. But at some point, an adolescent becomes an adult, and those responsibilities will be upon the older teenagers, and they just have to learn how to make right decisions. But I am thankful that social media wasn't an influence during my time.
Yeah, and social media is just like, I didn't have like Instagram until a few months ago, and I'm so grateful for that, because I don't know if I would have been able to like stay off of it. That, for me specifically, I probably would have been a very, very harmful like feedback loop of me just like keep constantly checking on what other people are doing. And like how you said back in the like before social media, if you were being like bullied at school, when you left school, it was over. You were at home, you're with your family, you're in a safe place. But now it just keeps going because there's constant access to like everyone. Have you seen like an increase in like mental health uh
Yeah,
problems in kids?
yeah. All you meant, yes, and a great point. You make a great point there, because it doesn't stop when you leave. And I have three older, uh, children. My youngest now is a senior in high school, and two in their 20s. So yes, you're right, and I do see that, and I see how that becomes an issue, not when they just leave school, but although that needed to be addressed back in the day as well. But as far as the mental health component, it's absolutely, absolutely. You throw in these last few years with COVID and I don't want to put it all on COVID because I don't think it is all COVID, but when we were home for a year and really we need those phones are what kept children and adolescents and all of us engaged. And thankfully, there was some great engaged though with each other, with our friends, with our peers, not maybe the social media didn't serve its role, but at least as far as the engagement with others. But yeah, yes, when it comes to the mental health crisis, the well-being, I'll say the mental health well-being in general, definitely is a concern. And I think there's a little bit though where I applaud the fact that people are more willing to recognize it. This is a different time, and I think it takes a lot, and I think it's more easily I don't want to use the word accepted, but brought up and understood that it's an issue and there are things to address it, which I think is so valuable when I have a younger teenager or a preteen who gives me the clues that are directly saying that I need some help. It takes a lot to do that, and I certainly applaud it. But kind of getting back to your question, yeah, the mental health crisis. I don't know if I want to use the word crisis, but the mental health well-being is definitely a tremendous concern and issue that our children are facing these days.
Yeah. What are some of those cues that you're talking about of a child saying like, I need help, something is wrong?
So there are questions at pediatric. It depends on the type of what type of visit is. But at my routine well child care visits, I'm comfortable saying that I'll ask questions about their mental well-being. There are forms that sometimes we'll use and questionnaires that we can use, but also there'll be things about school. And I specifically looking like at depression or depressed moments or anxiety. Now, I think it's pretty common. Everybody's got a little test taking anxiety. I haven't met many, and I've been thinking about this closely. The last couple of weeks, I've been asking my patients, and everybody's got a little bit. I remember having a little bit. But when it comes to depression, as far as feeling sad, as simple as just asking, are there moments where you are feeling uncomfortable about a situation, whether it be at home or school, with your friends, really tackling it, not tackling it, but really addressing it from all avenues of one's life. And sadness is an emotion. It's an acceptable emotion, but it's how you respond, how you bounce out of it. And there are some who say, yes, I do feel sad, but I bounce pretty quickly. I can talk to mom, dad, and it's quickly. And there are others who say, I have a hard time finding a way out. Now that's pretty direct, but that is a child who if is not already receiving some assistance or help, it's time to find some. And at that point we figure out a plan in order to address that.
Yeah. A little bit more on the lighthearted side. What do you think of the movie like Inside Out? It's kind of this kind of concept of your emotions are broad and it's okay to feel them?
So there have been two. I saw the first one. I have to admit, I haven't seen the second one yet, but I've had many of my patients talk about it. I recall being very pleasantly, well, enjoying it. I think it's just, I think the more we understand about our mental health, just like our physical health, the better individuals we are. And will become, and the healthier, I mean, it's not the better, but the healthier individuals we become, having a greater understanding. It's uh, anything to help it become more of an addressable issue rather than just kind of sweeping it under the rug, so to speak, a term, from maybe my day, but addressing it. And not everything needs to run to a therapist, but at least to know that, there are tools in place. There are measures that we can take that can be of assistance. But I think the idea and the premise of the movie, although I haven't seen the second one yet, I applaud it.
Yeah. And going back to COVID, how did Zoom and like the closures of school really affect the development of a child and even their socialization and further beyond?
I overall very impactful. Individually, there were some who did very well with it, and impressed, but many had a difficult time. It's and maybe there's more to it because of the impact on everyone involved, the parents, the caregivers. Someone had to be addressing the youngsters, because we could look at it at each age range, whether the kindergartners who were missing out on that socialization, which I think is a very important component of those early years of grammar school, or elementary school, excuse me, but especially kindergarten and TK, versus the preteens, the middle schoolers who they're working on, they're maturing, they're dealing with new emotions, their hormonal changes, and unable to kind of express that one-on-one, and maybe through the camera, and then through learning through school, and then however they communicated afterward. But and then just going to the educational part of it, some were not meant to be online 6 hours a day or 5 hours a day. I know the days were truncated a little bit there. Some have learned it, and it's, you may be experiencing in college now where you're able to do some classes online, but you could find that balance. You could find what works for you. This was a thrust of everyone into it, and clearly it was not made for everyone, but it was just something that was done due to the time frame, the time we lived in, just a few years ago.
Yeah. And like I was the middle schooler in when COVID hit, and I just moved to a new school and it was going really well, and then we were all locked up, metaphorically. So that I think still that may have some repercussions that I'm not fully familiar with yet. And maybe I'll see them like rear their heads again, but as far as I know, like it was rough, but it leveled out.
Yeah, life is about experiences, and everyone has a journey. So hopefully one day you'll be able to look back and say, well, this was my journey, and not just your journey. I mean, a lot of people went through similar, but it was your individual journey, and it'll help form who you are. I looking at these sessions here, you and I are we're having a chat, so to speak, an interview, if you want to call it, and this might not have occurred 5 years ago because not many Zoom folks, or whichever, Microsoft Teams, and so it does open up other avenues, and something here that you're taking advantage of. So just keep that in mind too, that it does create, but yeah, I don't think there's any one individual adult who would ever say that the most impactful was on our children. And the resiliency by many has been amazing, but this was not we're in it for just a brief period. I mean, there's a a trailing effect here, but I'd like to think that each and every year we get farther removed from that time, that specific time frame, that that balance could be found again.
Yeah. Speaking of journeys, what was your journey from to becoming a physician?
Yeah. Um, so I went to school, specifically UC San Diego. So any Tritons out there, big shout out. Loved my time down there. I After undergraduate, I decided to follow the master's in public health. Interestingly enough, public health is now a more common undergraduate degree, and I guess I knew about epidemics before most people did because of, well, maybe because of medical school too, but just because I was always enthralled by them. And here we go. We had COVID in our lifetime, which was not to be necessarily be expected, but maybe not a surprise to some, considering that big flu pandemic was a little over 100 years ago. But we have little outbreaks here and there, but nothing like a pandemic of what we just experienced. But I really enjoyed the epidemiology of public health. So I came back up to UCLA and did a master's in public health, and was close to following it with a doctorate degree. I thought I would enjoy it, but I got drawn back to the mindset of, I think where my true talents would just be best fit would be back in that world of pediatrics. So gave it a go and went to medical school in Chicago, and enjoyed the 4 years. I'll put a little shout out. I got married during medical school. I had my first child, or our first child, my wife and I had our first child in medical school out in Chicago, and came back for residency because this was kind of our home base, and a lot of great programs out here, and really haven't looked back. So,
Yeah. How did you make that distinction between going all the way in public health and then pursuing your MD? What was the specific I guess moment where you decided?
well, I think part of it. That's a good question. There were a couple. I think what it came down to. I'll just break it down to the simplest point. I really enjoyed the public health angle, but I think also, in this day and age, and it's only become more difficult, you just never know what happens with getting into medical school. And I like to be prepared, and so if things didn't work out, I wanted to make sure I had a plan. I see many more than well-deserving who would be fine physicians in whatever field they would want to do one day, but you got to get in. So I wanted to make sure that I had things in place, or just had a plan. I mean, not everything was dotted and crossed at that time, but I just wanted to make sure I had something in place. But I mean, ultimately, if I got into medical school, which I did, I wasn't going to look back, and I was going to take a hold of that situation and go with it. If there's ever a case for just a lot of hard work and perseverance, I'm probably a pretty good representation of that. But I was also acceptant of, I think there's more than, there's always another path. There's always something else that you can be fulfilled. But I was certainly honored and happy to take that next step into the field of medicine, and specifically pediatrics.
Yeah, like for me personally, I'm a very big planner. I like to have everything laid out, and like have backup plans for basically everything. And I think that's partially to my detriment, is that if something doesn't stick to if I don't stick to the plan perfectly, the whole thing goes awry. Is that something that you've experienced? And if so, how do you combat that?
Yeah. I don't think life will ever go as planned. Whether I learned that in high school, or maybe relationship failures, or a bad test, your first bad test in college or wherever it is, where you're not used to those, and or not getting into the school that you want to go, get into. I mean, there are going to be setbacks, and I think that's a good thing. I think that's where one thing as parents, it's okay for our children to face some, moments of disappointment. Um, there will be other greater moments, a loss of a close loved one, or many, throughout life, and probably tipping the scales as far as what's the most significant. But test scores and getting into schools and plans. So I think it's okay, and it's nice to have a plan. It's nice to have options, but at the same token, be okay to pivot a little bit. I know that's a term that became popular during COVID, but I think I think it taught us to pivot. We had to pivot, and I think that's something that as individuals, sometimes you have to have a pivot, and sometimes adversity. I think that's the word I'm looking for. It helps create who you are. It's part of the journey, and at the end of the day, it's your journey. And if you face a little adversity and it changes the direction a little bit, that's okay. Just go and and go head on whatever it is that you're going to do, but be ready to face some adversity and pivot potentially too.
Yeah. Have you seen that in your patients? You have some kids that uh, you know, have not had as much adversity versus some who've had a little more. Is that like a personality shift that you see?
Um, Frankly, I think there are different levels of adversity. So I are different, yeah, well, different levels. 0 from 10, 1 to 10. And maybe some have faced greater, absolutely, completely out of their control, and some maybe more minor things, but still adversity. Again, I think the earlier you may face one faces some adversity, I think the more helpful it is in the bigger picture. You're closing in on 2 decades. You're getting closer to that. God willing, there's a lot more decades ahead, and you're going to use these experiences, and they're experiences that I go back to 30 years ago, 35 years ago, and when I was at that level, or even in my early 20s before getting into medical school, and I think about them and how they've impacted me, and I wouldn't change a thing. So, but well, let me rephrase it. A loss of a close one at an early age, I think would be one thing. But I mean, I think as far as the personal adversities when it comes to goal setting and things of that nature.
Yeah. I mean, in like our current structure of society is super focused on convenience, right? Like I can go on my phone and order like all the cuisines imaginable, right? And that's going to affect like children who like before like the phones and social media, they were like I guess playing outside more even. They were just being they're being rough, or they were doing things
Yeah.
outside of the phone. And it's going to completely change like how the kids see the world, how the adults raise the kids. It's wide ranging impacts that I don't think we felt the full effects of yet.
I don't think I could have said that any better. I think you're right. I don't think we have felt the full effects, but I do hope there's a little bit of a pendulum swing backwards here. It just doesn't happen overnight, though. So, but
Yeah,
very mature statement that you're saying there. So I agree.
Yeah, let's go back to like your clinical practice. What do you see on most days? What kind of patients?
Boy, I see a little bit of everything. So, I mean, a day could be anything from a 19-year-old who's coming in, or my 18, 19-year-old, a senior in high school who needs a sports physical before going to school that day. And then the next one will be a newborn. And we do try and group our physicals and ill visits at different times during the morning. That all started through COVID. But but then I'll see some ill visits later in the morning. I'll see a variety, and a physical of a newborn obviously is a different physical from an 18-year-old, which is a different physical from an 11-year-old, which is a different physical from a 5-year-old. So a variety of physicals, all ages up until about 20, and then the ill visits running from sometimes a common cold, but sometimes not, and sometimes a little bit deeper. And something that I always try and do is educate my parents. That doesn't happen on the first cold, but after first visits of when to come in, when to seek care, and maybe with a little more complicated issues or prolonged issues. So, but from illness, any type of illnesses, to also mental health discussions too. Our mental health colleagues are a little overwhelmed these days, and so some of that has come. Some of us pediatricians have tried to help the situation out because it needs help. It's a team environment, but just a variety of ill visits to physicals to who knows what will walk through the door.
Yeah. How have you seen urgent care affect your practice? Because I know I've seen like in my job at urgent care, like the sports physicals and like babies with colds and just the whole spectrum that they should probably be seeing their pediatrician for. How is that? How have you seen that?
I think if I can ever say, if there's an opportunity to see your own physician, or at least one of your colleagues' physicians in the office where we know you, where we have your history, I would always recommend that. Now, it's 2 p.m. on a Sunday and your general pediatrician is closed. His office or her office is closed, and you need to see someone because you need to see someone of the urgency. So I always encourage to see a pediatric, someone with pediatric experience. So there are some pediatric urgent cares because pediatric medicine is different from adult medicine. It's a different mindset. It comes down to the medications because they're dose related, but also, so that's the one instance where I'm like, well, I'm thankful that there are some there, and they don't have to go to the emergency room necessarily for what may be an ear infection or a bronchitis or something that doesn't require a true emergency room, but they need to be seen because we're closed, our office is closed. But I get concerned when you don't know your patients, and that's something that I treasure, knowing your patients, because I think when you know your patients, it puts you down a path of having an understanding of a little bit better understanding initially of how to address the situation, what to do. So, but I'm not going to completely, I think there's a role, but if there's ever an opportunity to see adult or general or pediatrics, it doesn't matter to me. It's best to see someone who knows you best. And that's usually you're going to be your pediatrician and your own physician as an adult.
Yeah. And I think a part of that, especially when you're working with kids, is if the kid knows you as like their doctor, they're not going to be afraid to come in for a vaccine or a physical. Like I know that was my experience. I was never like, at least as far as I remember, I was never afraid to come in. I was like, okay, I'm just going to go see the doctor. Like he's kind of I don't know, he's like a weird part of my extended family, So I think that's another huge aspect. Do you agree?
Yeah, the comfort level, absolutely. And I hope it's okay. Take this out if you have to. But I don't. I think even when you were sick, you always came in with a smile on your face. So you were always you've always been very comfortable in the office. I hope I can say that, Elon. And if you have to take that out, please go ahead. But there are some though who are uncomfortable. But yeah, it absolutely goes a long way. The comfort, not only just your pediatrician, but for the parents too, coming in and seeing the people at the front desk, and then our the medical assistants, the ones who often give the vaccines, but prep our patients. And I mean that comfort level, that connection, those eyes, and when you go to I'd say a medium-sized office, but an office where we know everybody. I'm not going to use a Cheers reference here, but I'm just going to say it's the comfort level of coming into a place where is definitely going to be helpful. But I still have some 2.5-year-olds, and I think if they saw me outside the office, they might run the other way. But I think that's typical of some 2-year-olds because they know what goes on in a pediatric office, and then often it usually means some pretty good understanding and pretty good development because they know that they might get poked or prodded along the way. So
yeah, and boy, I lost my train of thought there. Made me laugh a little bit.
Good. Good to laugh.
Yeah, the best medicine, right?
It is. It is.
Yeah. So what was your residency like? What was the most valuable thing you learned from your residency? It's kind of two separate questions.
Well, I I think the most valuable thing, and I might go back to medical school. I thought it was I was doing an internal medicine, so adult medicine medical rotation. And it was either the chief of the department who had a few of us medical students or some higher up in the department, I remember. And he looked at us and he said, the most important thing you guys can do is listen to your patients, and ... before you speak. Patients want to be heard. Sometimes a physician might know the diagnosis, or have a pretty good hunch on what the diagnosis might be, but they want to be heard. And I think that goes to any aspect in life, in any profession. Somebody comes in, they want to be heard before they're told, something. So I'll always recall that. And, there are times where I pause myself and I remember these words, which probably are pretty close to about over 25 years ago now, when they were said. But and it was just a small group. I'm assuming he said it to many, or maybe there was something going on in the group that I was a part of, that felt we needed to hear it. But I just felt that so valuable. Not always easy. And I have children, and one day you'll probably understand this too. You sometimes you jump in, but people want to be heard. So, including your patients and the patient's parents, depending on how old they are. Residency was great. I trained at UCLA, and was glad to be back in LA. And again, there were a lot of great residency programs in the greater LA area. So pretty comfortable. We were glad to be home. Our family was growing. So we had a couple of grandparents who were more than helpful, in partaking and taking care of our kids at times. They enjoyed it too. So it was great. But it was definitely trying. A better person might be to ask is the spouse of what residency was like, because I just did what I was told. This was a little bit before I think you could have 30-hour days, even in pediatrics, or 18, close to 30-hour days. Actually, I take that back. Well into the 30s, before they mandated, I think, some new guidelines, and I don't know the new guidelines, but which I don't think was necessary, but those made for long days and lack of sleep. But beyond that, though, it was a great experience. You're going through it with others. A couple of colleagues who I shared call with probably the most are two of my colleagues that I refer to. They're consultants in the community in the pediatric world. They're subspecialists, and just to have that bond and that being able to connect. We go way back, and it's great to have that. But it was a trying experience, but I think it serves its purpose. Although I certainly had no problem when I heard that the hours were reduced a little bit, the mandatory hours in a row that a resident can have. But don't quote me on those hours, because I'm not sure. I'm not sure those last few hours were necessary. But again, one of those experiences that even though I wouldn't want to go through residency again, I think it just helps shape who you are as a person and a professional.
Yeah, and the camaraderie, I think, is something that people get lost on a lot, is that you have a class of people who are from all across the country, and you are just in the mud together. And that is huge help for like a resident who's working 80 hours a week, doing 20-hour days, like stuff. I want to go.
Great point.
I want to go back to the point of how you said a patient with a tricky diagnosis. If there's a very young child who maybe can't speak like in full sentences, or is and just has a hard time communicating, how do you pinpoint what's wrong with them?
Yeah, that's well, first off, you Yeah, that is, it's a good question. When the communication, one thing I'll say is that when it was clear to everyone back in medical school that I was going pediatrics, of my group of friends, I was probably the only pediatrician in the group that I was, close with. Many called it veterinary medicine, just because of the fact that they're unable to communicate. But they tell you so much, though. A pediatrician, and this is kind of where you hone your skill as a pediatrician. You walk in a room, and I don't know if parents always notice this, but you can get a good sense or a sense of how significant what is going on. I'm not going to say it's 100%, but that's what pediatricians do. They come in and they are already observing their patient. It's like it's because there are clues that could be found, particularly when it comes to respiratory issues, any distress or anything along those measures. But you got to listen. So you observe and you listen, and you got to listen to the parents, the parents or the caregivers or whoever is bringing that child in, on what their concerns are. You have to listen to them, and then from there, you go through a very detailed exam, and you make sure that everyone is on the same page when you're done, and say whether it's a clear diagnosis or not a fully clear diagnosis, but here's the game plan. Here's what we're going to do. Here's what I want you to do if there's any issues. But if it's not a clear diagnosis yet, but it's a lot of observing the patient when you walk in the room, communicating with the parents or the caregivers that are there, and then also just doing a very a good and solid exam.
Yeah, and back to your point on veterinary medicine, is I read somewhere that veterinarians and pediatricians are the best like diagnosticians, because their patients do not like speak to them. They have to go on the objective findings, and they can't like they have no subjective history really. It's very hard to get one.
Yeah, it's there may be clues. I'll use a simple example, like if you have a 14-month-old and recent fever, resolve, cold symptoms, a little bit more not sleeping as well the last couple nights, maybe a little warm, or temperature the last night, and then possibly touching the ears, or possibly not, but just a little more grumpy, and wasn't grumpy the couple days ago when the cold began. And you better check those ears, because an ear infection certainly can be something to explain all that. That's a rather easy, straightforward Gen Peds sort of one, but it involves everything that you just mentioned. So exactly.
Yeah. What is something that in a physical you would do that like an internist or an adult medicine practitioner would not do?
I think the exam, well, and in the actual exam or taking, I just want to make sure I understand, or history taking. Are you talking about the physical exam?
Let's do both. Let's do one like a physical exam and history.
All right, so we'll go out of order. Usually we do the history first and then the physical exam. But I think with the physical exam, I think if you've got a good clinician, it's a head to toe with the pediatrician, and it's a head to toe with the internist, the adult physician. So, when you get to, and I'll leave it there. I mean, there may be some specific things that are a little bit different between, when examining a pediatric patient versus an adult patient. But at the same token, head to toe is head to toe, and everything in between. And that's what I tell parents and children when we go through the exam, that we're checking from your head to your toe. Your parents are right here, and so on. And but I think a head to toe is a head to toe. So if there's anything more specific, I'll allow you to follow that up.
Mm-hmm.
When it comes to a history, it's different. I think the one difference that just kind of we're talking a little bit about adult medicine and pediatric medicine. Pediatrics, our goal is to prevent. We want to prevent hypertension. We want to prevent high cholesterol. We want to prevent diabetes. Well, those are the things that the adult physicians, not all their patients will have it, and they would like to prevent it too. But as we get older, these things creep in, no matter how, even if we're taking pretty good care of ourselves. So So that's our goal as a pediatrician. It's more about prevention. And I'll say still it's part of adult medicine. Just at some point, though, these things are not preventable anymore, and they're here, and then they need to be treated. So we talk about all those measures. We go back to those, the three core things that I had mentioned earlier when it comes to sleep and healthy, balanced eating and good physical activity. If I feel like the parents are struggling a little bit with getting the child to listen to them, I'll say, well, the fourth thing is always listening to your parents too. So, anything to help them along. But I think you understand we're trying to prevent as pediatricians. So a lot of our questions are, when it's a routine well child care visit or a physical, we ask in relation to those. There are other questions that are asked too, but definitely want to make sure we cover those three.
Yeah, I think there's also a huge shift in adult medicine for prevention as well. Not necessarily for the even like the internists, but on social media online, there's just a huge preventative medicine space of let's just get in the gym, let's sleep, let's eat well, so that we don't have to deal with hypertension, diabetes, high cholesterol.
And just to follow, and you're right. I guess at a certain point it might be too late. But I think that's the benefits of the smartphone. You can pull something up and kind of help give you some guidance on what to do too when it comes to these things, or you can get on the computer as well. But I think the whole thing is it is all about prevention. And then if you need to be treated appropriately.
Yeah. Recently, though, with the new GLP-1 agonist, this is like, I think this stuff is so important and so interesting. For pediatrics specifically, like childhood obesity can be something that follows you for the rest of your life. Do you think that these new drugs may have a place in like the pediatrician's office?
Well, a good specific question. They already play a role in some of our seat and in some of our endocrinology pediatric offices. So will there be a trickle down where us general pediatricians might be addressing it? Yes. Might it already be happening somewhere? Yes. I don't know of any colleagues yet. I'm comfortable saying that I've referred some patients to a endocrinology group, and it was deemed that this would be a benefit. One of these GLP-1s would be beneficial for the patient, and the patients are doing well. So when do I think that this might trickle down to the general pediatrician's office? A lot of things do ultimately. Our subspecialists, we live in Los Angeles, and our subspecialists, and we have some great facilities and great, with the subspecialists and some great community subspecialists, but they're overwhelmed, and the delay sometimes to see them is pretty significant. So, yes, ultimately, I would like a little bit more of that safety profile to be kind of locked in the pediatric adolescent world. But do I see it trickling in at some point? Yeah. Yes, I do.
Yeah. Why did you personally decide not to subspecialize?
I think a couple reasons. One is I didn't want to miss out on this general pediatrics world. I love the 0 to 20 or 21 or whatever number we're using, but usually, let's say the first 2 decades, from newborn to second year of college or wherever they are, after high school, and just being a part of that process, and hopefully maintaining and promoting the good health of that child all the way through. I would not have gone that in any other fields. I mean, there are rewarding things. I was interested in cardiology for a little bit in residency, and I thought about it. And you can still connect with your patients, especially the ones that are, chronic, that have issues that need, visits every year. But I think there's just something so special about the dynamic between a pediatrician and, the patient when they come in for healthy visits, routine care, and then for the ill visits too, and kind of blending that all together. And I just felt that that was my natural fit in the world of medicine.
Yeah, you kind of gravitated towards like the longitudinality of it. Is that correct?
Yeah. Yes. Yeah.
Let's talk about the public health angle a little bit more, if you don't mind.
Yeah.
So how does your public health like experience affect just the general patient visit? Do you view it differently than someone who maybe doesn't have as much public health experience?
That I won't speak to that because I don't know how someone who doesn't have a public health training. But I think it's important for all physicians, particularly in the primary care setting, whether it be adult or pediatric or somewhere in between, understand the role of public health. I think we talked about it earlier. I mean, the number one public health measure anyone could do is wash your hands. That's it. It's that simple. But that's a public health measure. You don't do that, illness will spread. So, and that covers from kids all the way. And it's a little bit harder when children are at preschool, and that's why some illness. That's one of the reasons why they get sick, maybe a little bit more. But we are able to wash our hands as we get a little bit older. But I think when it comes to the other measures and and the importance of immunizations, that is a public health. They have saved lives, and for it's something to be forever indebted to some of these vaccines and how beneficial they have been. And then so that's another public health measure. And I guess it goes back to what we had talked about earlier a few times when it comes to like the importance and the role of healthy sleep. I mean, if you don't get good sleep, impacts your focusing. It impacts, some parents like to put the growth, but I mean, in so many, the focusing, the growth, the mental well-being, the immune system, heart health. I mean, the list goes on and on. And there's research behind all this. And so these are easy public health measures. And then I think, well, not easy to follow necessarily, because some situations, and as far as healthy eating, not always easy for all groups, to have the benefits of healthy foods but still knowing the importance of the role that they play there and doing our best to get better foods, healthier foods, to all of us, but and particularly from my angle, to all of our children. So
Yeah. If someone maybe doesn't have a lot of access to like very like fresh foods, like whole foods, how do you go about navigating that?
Yeah, that can be tricky. I guess that's something in my current patient population. I don't have to, how do I say, specifically address the inability to obtain that. But one thing that I do is I will, all parents want to do with, I'm a big believer, all parents, they all want what's best for their child. And sometimes however they come across, that's their goal. That's my goal. I mean, as a parent too, so I get it. So I understand the frustration. Sometimes I understand. I'll circle. This is going to circle back to your question too, Elon. But that it's there will never be any pressure from me to say you could do better. I mean, you should do better. We do the best we can with the means that we have there. So I know schools try and put healthier meals out there, and a free meal is there for everyone. That was not something there back in the day to all. Now we can debate how healthy the meals are, but they are still meals at this point. And again, I'd like to think over time it will only get better. I hope that's not too ambitious a thought, but I think it's do the best you can with the means that you have. and go from there.
Is there like an argument between quantity and quality of food? Like if a child just is, I guess I kind of answered my own question right now in my head,
Yeah.
but if like, never mind. I figured it out.
Yeah. Yeah. I think something dramatic in my experience is we used to have a pyramid, and now we have a plate. And I grew up on the pyramid, or at least I think I did. I mean, that's all I remember. And then we went to the plate, and like, yeah, this makes a whole lot more sense. The pyramid was a little more complicated, but the plate kind of makes it simple. So we have a picture of a plate in every room, and that's in its basic forms. But yeah, the obviously the quality. You want to make sure there's enough quantity of the quality. How about that?
Yeah.
So
Because
quantity of the
in
quality.
my head, I've just figured out like if there's a quantity of low quality food, the child will just like gain weight. But if there's if there's better quality, they're just overall healthier.
Yeah. And I think it's balance. It's really about keeping a balance. I mean, I have a sweet tooth. Many patients do. I'm always surprised when I have a child that doesn't have a sweet tooth, but they do exist. It's just not the majority. But it's easy for me, or sometimes not easy, controlling that sweet tooth. But to expect a 6-year-old to control the sweet tooth, I think is unfair. You give them a few candy bars in front of them, they're going to eat them. So that's where good parenting comes into play, and keeps things in moderation. So
Yeah, and I mean, just oh my God, I lost my train of thought again. Yeah, I mean, most kids, at least I mean, my experience. I was struggling with my weight as a child, and I was very much into sweets, and I mean, yeah, it was a whole struggle for me, and I'm sure for many others. Yeah.
Yeah, I think, and I'll address that too, even though there wasn't a question there. So when it comes with weight issues, well, it's certainly something I don't like to reference directly. I think where I go is I emphasize doing all the right things. Yes, we look at a weight curve, we look at a height curve, we look at, as the children get a little bit older, we don't do it in the first year, the body mass index, the simple curve that includes the height and the weight, a calculation to try and get like that proportion. But I want to emphasize doing the right things more than a specific number. Now, some numbers certainly need to be addressed, and more directly. But I mean, a lot of times it's all about trying to do just doing the right things. I think that would serve us best. Unfortunately, sometimes there's influences that come from all different directions: peers, social media, regular TV, advertisement. I drive to work every day, and some of the billboards I see, I take one of the main, boulevards, and there's a lot out there that's very impactful. At my point, my age, I don't think I'm as impacted, but I still remember some billboards when I was growing up that that still kind of haunt me, just because they were, I thought, a little over the top, and so I'm sure it's still going on today. So it's trying to emphasize doing the right things, and letting the numbers fall where they are, where they may, and then seeing if that really still needs to be addressed.
When you said like they haunt me, the first thing that came to my mind was like the billboards or the campaigns, the ads of teenagers smoking and how to get that to stop. Are you seeing a lot of teenagers that are getting into some unhealthy habits, and if so, how do you try and counsel them on that?
Yes, it requires a teenager to be upfront with me. And sometimes there might be a parent who might give me a little insight, because what I try and do is I'll always try and have and most pediatricians do have a little dialogue with the patient when they're older, just about some of these issues. And some are honest and some aren't, and sometimes some good things come out of it. because I'm able to explain the concerns of what's going on and measures that can be taken to address that. But it all starts with the honesty too, though. So I have to get that. But some parents will, they'll give me an indication. Please talk about this beforehand, and we'll do so. I think something that I always encourage, and I know it's difficult. I mean, I remember somewhat of being a teenager, but for children and adolescents, always to be open and communicate with their parents. Again, once you have a child, it's just a different. It really does change, and you just want ultimate health. Now, there are going to be times when your child's not going to be healthy, and that's tough. I mean, I've personally experienced that too. But being able to communicate with the parent about what's going on and being upfront is so key. It takes a lot. I applaud, I encourage, and then I applaud those that are doing who are able to do that. But there are times when the communication may not be there, but the parent has some indication, and then they'll share that with me, and we'll have a discussion, and maybe without going into specific game plans, but just addressing that issue.
Yeah. If you don't mind me asking, are there any times where the parents have not aided in your dialogue with the patient?
I want to make sure I understand that question completely. Where they're trying to hold something back about their child, or
They're in that, and also if they are hearing your recommendation, like for I don't know, like a vaccine or something, and then they're going against it, and it's the best thing for the child.
Right. Look, this goes back to every parent wants to do what's best for their child. I get it. That may create some discrepancies or differences in maybe opinion. But I will always respect that every child wants to do what's best for their parent. I can't lose sleep over that. Again, though, I may have a difference of opinion. I will do my best to educate, explain without intimidating or coming across negatively. But all I can do is explain as best I can on why something should be done, why we won't do something, whatever the case may be. I mean, I don't want to make it all about immunizations, but even as simple as using antibiotics or not using antibiotics, or when to use antibiotics. Because we have to be careful on using them too often. But so that's where I want to make sure that every parent that comes in at least understands where I'm coming from, and they don't have any questions on what I'm trying to explain to them, and the course of action that I would like to take place. But I do know at the end of the day, I do believe at the end of the day, every parent really wants to do what's best for their child. It just sometimes it does. We can have differences of opinion, I guess.
Yeah, and you were just talking about how you interview the parent and how they aid in your discussion with the child in the room. But how do you effectively communicate with the child if they're very young? They are they have a hard time communicating in full conversations.
Right. Well, it just depends on the age. I mean, when I talk to teenagers one-on-one, that's a little bit different. I don't talk to 4 or 5-year-olds one-on-one. Parents are in the room for the entire exam and the entire questions and everything, because I do need them. And some 5-year-olds are very willing to answer things pretty well, and I'll look at the parent and I'll say, I think he or she's got things covered here. I don't think you have to clarify anything. And then there are some where I do need the parents to help clarify, because, I get nervous going to the doctor's office, and even at my age. So I understand why a 5-year-old would be who's very talkative once they leave the office. So I think what I try and do is just make every child feel comfortable. And if I find that the child is doing a fabulous job in answering my questions, then, I think that I'll try and make sure the parent is aware of it and let the child continue. But I try and balance that out. want to give everyone an opportunity to share things, and whether it's a physical or whether the routine well child care visit versus an ill visit. I want I want to make sure everyone feels like they've been heard. So
Yeah. Now let's go into some more of the reflective questions. What would you say to someone the aspiring pediatrician right now?
Yeah, I think it's a good. I think I think, and this probably works for kind of whatever it is you want to do. Go seek them out. What you're doing and interviewing, and getting a little bit below, a little bit deeper with the questions, I think is so important. But go seek out some time with whatever person of whatever profession of interest that you might have, and try and spend some time there. Ask those questions. The trials and tribulations of getting into med school, and then you're going to be working, you're going to be in school for a lot, and you're training a lot through your 20s. But I think the key thing is just finding someone to talk to, and maybe more than one person too. As far as me, I mean, if I have a patient of mine who ever has any questions, I will be always more than happy to spend some time and answer it and give it straight. Again, I don't know if I'd want to do it all over again, but I think that has something to do with my age now. But I would never have changed what I am doing as today. This worked out for me. But the more you ask, the more questions you ask, and the more you observe, I think is so key. So find out those areas of interest and follow through. And it goes beyond medicine, though. It goes with whatever profession that you might be interested in. But I also would make sure, just because pediatrics is a little bit unique, I think my time as a counselor, camp director back when I was in high school and such, I mean, that made it clear that I knew I could do this. I can work with both the patient, a youngster, and the parent, and felt like I had a pretty good knack at it too. Get the experience. I think with adult medicine, it may be a little bit, different. But if you want to be a surgeon, make sure that you are okay with blood, and needles and such. And so, you need to have some of the basics out of the way. But after that, then you want to talk to the experts, or talk to those in the field, and either spend some time, ask some questions, try and spend some time, and get a real feel of what what it's like.
Yeah. And how would you suggest somebody go seek out, more specifically, like a doctor who is in their specialty that they're interested in?
Yeah, maybe well, it depends. If you have a good I mean, for my patients, like I won't be offended if I have a patient who wants to go into the field of medicine but doesn't want to come close to pediatrics. That's okay, but they're interested in such and such field. If I won't know unless you ask. So if you ask and you say, I'm interested in urology, or I'm interested in oncology, or or whatever, pathology. I mean, you'd be surprised who we might know and who we can, refer you to. If your parents are in the medical field, or if they're not, or if you have a close family member, you ask them, or a close family friend. You never know who might know someone of, the area that you might be interested in. And maybe they can help establish a connection for you. So part of the world is communicating, and it's something it's I think with technology and the phones and being down, we don't always, I think maybe a younger generation doesn't always realize it, but communicating is key, because you never know what doors might open. And if there's anything I can impress upon the younger generation, is to make sure you're having dialogues one-on-one, face-to-face, checking your emails too and such for that as you get a little bit older. I guess maybe I have a little personal experience, but I encourage everyone to do that. But communicating, creating connections, it's important. You never know who might know someone.
Yeah, go look at another person's face. That's And
Absolutely.
my last question, if you were transported back to your 18-year-old self and you were going and you had the choice of doing all the things that you've done right now versus diverging off into a different path, would you still go the route of medicine?
Yes. Yeah. Yes. I mean, I grew up in a time different than it is now, but I think I still would have gone the path, and it's hard to do that because someone very near and dear to me. We can't change what we've done. We can only move forward. And so I try and look at life a little bit like that. Like we could that this is the path that I've chosen, but I'm pretty confident that I'd say if I was 18, this would still be the path that I would have chosen. Um, I just wouldn't want to remember the all 4 years of medical school, 3 years of residency, if I had to do it all over again. That's kind of a one and done sort of thing. But as far as doing and ending up where I'm at, the answer would be yes.
Yeah, that's hugely encouraging, I think, to a lot of people.
Yeah.
All
Yeah.
right.
So, well, thank you for having me. And
Yeah, thank you for coming on.
excellent questions, though. A lot
Thank
of
you.
well thought out, and I appreciate the time and energy in what you're doing, and particularly here with the questions you asked today. Very well thought out. So great job.
Yeah, thank you for being a great pediatrician. Thanks for being my pediatrician. I'm very grateful to have had you take care of me throughout my life.
Well, I like to say it's my honor. It's a real thrill to. I don't think I've had you your full existence, but I've had a good chunk of your years, and it's an honor to be a part of it. And then a little bit of me, it's just very cool to see where you guys end up and where you move on to. But thank you, and thank you for allowing me to be a part of it.
Yeah, of course, of course. I'll see you next year.
Okay, sounds good. Have a great
All
day,
right.
Elon.
You too. Thank you so much. Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.